Hello, everyone. I am Nayra Caballero. I work in Tenerife. I am psychologist and I work in IPS team. Uh, we help to people with severe mental illness to seek a competitive job. And we want to share this presentation about cognitive rehabilitation program called COGPAC that we use this program to improve our results. So we have to share the presentation. We have a lot of research and books about our results. First book, it's about the recovery of people with severe mental illness with a model that we call a network of network because we work with different professionals like psychiatrists, psychologists, social workers, nurses, all together to get a better result for the patients. The second book, it's about all our experience with the IPS team. And the third and the last book, it's called Empleo, Recuperación, Ciudadanía, las experiencias psicóticas. And we talk about our experience about more than 15 years and the experience of different cities of Spain with employment and Italy and France. IPS focus on competitive employment. We focus in the individual's choice of people, rapid job search. We work with clinical teams all together. Attention for client preference. It's very, very important if they work, if they have to, if they want to work full time or not. Unlimited support all the time and benefits for people, happy people in the long time. IPS team, we know that helps people with mental illness to find a job. We have more than 15 years of experience about this work. We work also with assertive community teams. I explained about that. We call network of network because we work all together. And it's the document that a psychiatrist sent to us with the information of the patient. So this is our process. Psychiatrists send the document to the IPS team. We analyze the preference of the people and we begin the job search. We work with the companies of the island of Tenerife. And if we have a job offer, we call the people. We explain the job. If people say yes. We we have an interview with the company and the people, and if they decide that he have an opportunity, pues we have to follow all the process with the family, with people, and the company, and the clinical team. If, for example, we don't have people that it's IPS team because they have or they prefer, for example, a course. We have to pre-vocational training for example, job training, step-by-step methodology, or occupational center. The IPS participants are severe mental illness disability, not to be in the most severe stage of the illness, desire to work, of course, valid proof of the disability. It's very important that participation and the family collaborate with us in all the progress. Also, we have experience with people with severe mental illness, and we have a good results. We know that people, not all the people have a good result. We have people with job failure. So we think what we should do with these people, and we began with this program called COGPAC, that we see that in USA have a good result. So we buy this program, and we think that it's very important because it's cognitive impairment. It's a common feature in severe mental illness. Poor cognitive functioning appears to contribute towards employment outcomes, and also can produce modest improvement in cognitive functioning. A good research have a lot of studies about that. And this is our personal profiles. We have most males than women, more people with any relationship, not married, and people, it's about it's 20 and 45 years old, and primary studies or bachelor studies, not university studies. Diagnosis, most of our diagnosis is schizophrenia. This is samples of the program. And we talk with 57 people with severe mental illness that consent to participate in this study, randomized, and we have 28 with the cognitive rehabilitation program, an EPS, and 29 with only IPS strategy. Inclusion criteria, not currently employed, enroll in our IPS, and have evidence of job failure. We have all the instruments to measure the cognitive functioning. It's so long. We have 2 or 3 days to complete all the measuring. And this is our results. You can see after the intervention, we have improvement in re-auditory verbal learning, significant improvement, and long delay free recall with the ANCOVA. The direct digit test, close to significant, but not at all. So memory, executive function, and verbal learning tends to relation with using this program a better result. We found into cognitive variables analysis a moderate to large effect size for the treatment group at 8 months, and delayed recall and informed variables in 1 year of follow-up. Direct digits, 1 year, reverse digits, keen attempts, 1 year, and delayed recall, 1 year. And what about the employment result? There were significant difference on persons who found competitive employment as well. People with IPS and cognitive rehabilitation program have better results. In our conclusion, the results provide a support to the effectiveness of COGPAC in improvement cognitive functioning. And people who receive cognitive training have got significantly more jobs than people with only IPS. But we have to